joint degradation a primary issue for you, or is it simply a symptom of a bigger underlying issue that may be going on? In today's episode of the Exercise is Health podcast, Julie and I discuss this question and what else might be influencing joint issues that you may be experiencing, such as arthritis, disc issues, or anything else joint related. We're going to cue the intro song now and then jump right into this conversation. Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we're coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. And if you are looking for a way to build the health and function of your body through exercise from the comfort of your own home, then you need to check out the MAS at-home workout program. This program contains over 100 workouts that are all video guided and can be done using minimal equipment in under 20 minutes, including resistance training, cardio workouts, mobility workshops, and recovery days to help your body stay feeling well and make sure that you can exercise on a consistent basis. So if you want to learn more about this and download your copy, go to homeworkout.matschaumburg.com. Now today, we're talking about something that's very prevalent from an exercise perspective, and especially with our expertise from a muscle perspective, and that is this idea of joint degradation. Joint degradation is something that a number of people experience, whether it's disc issues, arthritis, or other joint-related issues. And we're posing the question today, is joint degradation actually a symptom versus a primary issue?
Oh, Charlie, I love this topic because contrary to popular belief, these what we call joint degradation issues, usually people label as the issue. And we're going to talk about ways that it may, or how you and I might view that it might not be the main issue. It might be the symptom or the result of the main issue, and how you can maybe go about addressing this. Because oftentimes, if we're able to figure out ways to manage different things in our body, we can figure out a way to manage them so they're not getting worse, so that we can continue with our quality of life. And remember, that's like me and Charlie's biggest thing is like, we know some people love exercise, some people hate exercise, some people are interested in muscle function, some people are not. But at the end of the day, I think all of us are interested in living our best lives, or living the life we want to live, doing the activities we want to do. And so that's why I think today's topic is super important. And I think two of the very common, you already listed them, but two of the very common joint degradation things is the presence of arthritis. So many people have arthritis. And I just did a quick Google search, and it said that over 3 million cases per year in the United States are diagnosed. And another one is disc issues. And I just looked up herniated disc, which is a disc issue, one of many. And over 3 million are diagnosed every year. And Google says they are very common. I guess we could spend a lot of time diving into the details of how many exactly, but that's not the point of this podcast. I just wanted to bring and give you that very non-referenced reference point so that you can get some kind of idea of how common this is. Because if you're listening to this, I've heard that over 80% of people over the age of 30 have a herniated disc. And so I'm sure there's a similar statistic somewhere that would be way more accurate than what I could pull out of my brain right now about arthritis. And these kind of issues really limit people's ability to do the things they want to do and enjoy the life in the way that they would like to enjoy it. So that's why we need to talk about this today. And again, a lot of times when we have arthritis, or we have a herniated disc or a bulging disc or any other of these joint degradation type symptoms, we think that it's not the symptom, and we think that it is the main issue that is causing all the dysfunction or the limitations that you might be feeling.
So just a quick story to kind of give you some insight as to far as where we're coming from. We have a number of clients. I'd say well over 50% of the clients that come here to Muscle Activation Schaumburg come in with some either arthritis-based issue or a history of disc herniations or, a current disc issue. And so, to go along to just feed the stat that Julie gave, it's really prevalent not only throughout society, but definitely with, the clients that we serve here at Muscle Activation Schaumburg. Well, it is not uncommon at all for those symptoms that are related to the disc issues, those symptoms that are related to the arthritis to fluctuate and change. And especially once we start really helping their muscles function better and help improving the strength of the muscles, and this ranges throughout the entire body, whether it's arthritis with the knees, arthritis with the hips, arthritis with the hands is a really common one. We get the muscles of people's hands start functioning better and their finger and hand strength improves and they don't notice their symptoms as much anymore. So this is kind of where we're coming from as far as posing the question, well, then is the joint degradation just simply a symptom of a bigger underlying issue? Meaning, is the arthritis the end result or, part of the result of this other issue going on for years and years and years? Because the reality is from a structural perspective, we're not changing people's structures with what we're doing here with muscle activation techniques and what we're doing here with exercise. But we are influencing muscle function. We are influencing the nervous system. And that certainly has influence over people's structures. So even though the structure itself may not change, the influences to the structure might change. And so, that just makes us curious and asking, okay, well, these structural issues, are they actually the primary issue or are they the end result of something else going on?
You're totally right, Charlie. And I think what's so interesting with this one specifically, which can get really confusing, is that, as you said, these are structural changes. They're structural degradation, meaning like what has happened in the past has now degraded the quality of that structure, that joint. And I think we often don't think about joints as structures. So just so you know, in case you don't think about joints as much as Charlie and I do, which you probably don't, these joints are like hard, bony structures, right? It's like where two bones come together. That is what a joint is defined as. And when there has been wear and tear on the area, too much stress on the area, sometimes those bony structures and some of the different characteristics that make that joint a joint will start to wear out or change or become, I guess we could say, more degraded, like less high quality, like less brand new. And so these are the changes that we're talking about. And these changes oftentimes cannot be reversed because they've been structurally changed unless a surgical intervention has been done, or there is like some new technology with stem cells and stuff, which we aren't qualified to talk about. But unless there's some external medical intervention, this thing isn't going back to where it was. But that doesn't mean that your ability to operate this thing doesn't change. So I was just thinking of this example, and I always preface this every time I do it on podcast, and we didn't talk about it beforehand. This was not in our show notes, and I was thinking, I'm just going to drop it, and if it's terrible, Charlie can take it out. Anyway, so I was thinking about this. I was thinking about, okay, let's say you're driving your car. Well, we'll say your teenager drives a car, okay? And of course, I don't know, maybe you're someone that buys your teenager a brand new car or like used car, whatever. And every time your teenager comes home from school, you're like, hey, Jack, why is the outside of your car all beat up? Did you scrape it on the curve every time you turn out of the school? And And, Jack might be like, yeah, totally. Like, why not? And then, the next day, your son does the same thing, and then the same thing and the same thing. And you're saying, okay, that's enough. We're taking the car to the auto body shop, and we got to get this fixed up because this looks like a piece of junk now. Okay. So you go there and, they take the scratches off and whatever. And then the next day, your son comes home with the same scratches all over the car again, right? And so eventually the auto guy is like, hey, well, I can do the best I can, but some of these dents, this wear and tear on the exterior of your car, it's just not going to come out. So we might want to look deeper into the issue. Does your son know how to do a left-hand turn? Because it doesn't look like he knows how to do it without hitting the curb, right? And so what you're probably thinking as I'm giving this example, you're like, Julie, that example's so dumb. Why don't you just teach the kid how to do a better, smoother turn and tell him not to hit the curb every time, except, if it's an accident? Well, sometimes this is kind of like what happens to our joints. It's like our joints, we do stuff with our joints, and a lot of times I will say, well, not a lot of times, but I would say it's like 50-50. Like some of us are taught how to move poorly, or we exercise poorly, or we're doing something wrong. Or some of our bodies are kind of predispositioned to develop arthritis or some kind of these joint issues. Either way, it's developing. And as we create these joint degradation things where we're degrading the quality of our joints, oftentimes we think that that's the issue. And that's why, as the parent, we were taking the car to the auto body shop. But really, what can really help the issue, it can't reverse the issue and the damage that's already been caused, but is to say, hey, the user of this car, let's talk to that guy. Let's see if we can teach, this teenager or an adult how to better control this vehicle so that we're not getting all this irreversible joint degradation or irreversible, car body damage. I think that would be the right word. So what I'm slowly alluding to is that there are ways that we can, yes, not reverse arthritis or reverse your bulging disc or, regrow cartilage with exercise or with what we're going to talk about, which is muscle activation techniques. But what we can do is that we can reteach the user of these joints, how to better manage this joint. And we do that in two ways. Number one, we can reteach your brain how to move. Come to see us and we will teach you how to move a little bit differently and maybe better. And number two, teach your body how to manage this joint. Have you ever heard of this word called compensation? Most people have, and we've talked about compensation ad nauseum in other podcasts, but most people think of it as bad, I would say. We just say what it is. Anyways, sometimes we have to teach your body how to better handle this situation, because what your body's always going to go into is protective mode, which is good to a point. It can also be very wearing and tearing on your body. So there are kind of two ways that we can help teach your muscles or teach the user of these joints how to better manage these joints and not further a degradation, and maybe even get to a point where you don't even notice that degradation is there. You're like, wow, I have a herniated disc, but I wouldn't know I would have a herniated disc right now because of my function level. Anyways, one, through teaching you, like, hey, let me show you how to better do this arm lifting thing or side bending thing, but also teaching your body through muscle activation techniques how to better manage this joint.
Now, this is really important to understand because so often people associate joint symptoms as joint issues and joint issues as separate from everything else, meaning it's rare for me to come across somebody that says, yeah, you know what, I have arthritis in my knee, so, clearly it's a muscle issue. No. What people say is, oh, yeah, I have some arthritis in my knee, and I'm meeting with the surgeons, figure out when I can get the knee replaced. And to Julie's analogy, that's like saying, yeah, I keep getting these scrapes on the side of my car every time I drive. So I'm just, I keep taking it into the auto body shop, figuring out, what can get buffed out and, when the side of the car is just going to have to get replaced. And while that is an option, and for some people, don't get me wrong, like we've had a number of clients come in where like a joint replacement for them, that's probably a really good idea. And that's not a decision that we can help them make. That's not something that we can give input on. But they have a joint replacement, and then they come back, and after they have that replacement, they're doing much better than they were before. But that doesn't mean that the joint itself was the only issue. And so we just want to highlight today the role that the muscles can play in joint issues and why that is so important when considering what to do about joint issues. Because while the structure of the joint really is not, it's very unlikely that it's just going to naturally get better over time, the function of the muscles absolutely can get better over time. And there are very specific things you can do to influence that.
Now, the way that you know that you probably fall in this category, and I'm going to call all of you guys out because I want to get your attention on this because it is so important, is that when, for example, if you have like a back issue, what's the first thing that you think of doing? Some people think of going to the chiropractor. Most all people think, oh, let me go see the spinal orthopedic surgeon.
Mm-hmm.
And that's someone that has a great qualification to help people with a certain issue. But also, I think that people like this or specialties like this can be overused because the thing that's causing all those joint issues, by the way, there's like 133 joints in your spine. So if you have a back issue, that's a lot of joints that you can improve upon. It's definitely being overused. Or, for example, if you've got a knee issue, the first step that you take is, ooh, I need to go see my orthopod for my knee. Okay, so if you've thought that, or you know someone that has thought that, you got to think, ooh, Julie and Charlie are talking to me right now. Because, and we're not saying you're wrong for going to see that. But what we are saying is that there is another side to consider. And if you are looking for something else to consider, this is what we want to talk to you about. Because again, those orthopedic people that specialize in just the structure of the joint, like someone that's going to go in and clear out stuff or suck stuff out of your joint or replace a surface of your joint. Those people are like the auto body guys, where it's like, hey, totally necessary at some times, but there are other options. And the other option that we're going to present to you will hopefully seem, when you think about it, seems like something that is potentially going to prevent you from having major surgery or push back major surgery. There's a very popular belief out there that if your joint isn't doing that bad, it's kind of nice to keep the original parts because nothing can be as good as the original parts, meaning your joint. So if you've ever thought of that, please listen up, because it's so very, very common to think the first thing that we need to do when I'm having any kind of joint issue is to go see the structural person, which is normally the surgeon, and then tread back to muscles if they do recommend that. But we almost want to suggest, why not do the muscle piece first? Working with muscles, number one, it only can make you better, because everyone knows that if their muscles are working better, if they're stronger, if they're more conditioned, if they're more functional, even if you do need surgery down the road, you are going to be better off. And number two, it is far, far, far less invasive, meaning these side effects are way less than if you're getting surgery. And so if all you needed to do was change how you're moving, get some muscle activation techniques, then why not? Because so many people that we've seen is like, wow, I thought I was going to need surgery for this, but I don't feel that I need to anymore, which is really cool. And again, Charlie and I don't make that decision for people, but it is an option that is very, very often not even considered or explored because we think the power of it isn't really there. Where Charlie and I, we see this all the time where the powerfulness of the muscle system is totally there when used appropriately.
And Julie, that's a huge point that you bring up. I want to circle back to it because I think a lot of people may have missed it. And that is the idea that even if you're in need of having some kind of joint intervention from a surgical perspective, getting your muscles working well, getting your muscles functioning better, getting your muscles stronger, there's tremendous value in doing that, not just after the intervention, but also beforehand. I mean, I can't tell you the number of clients that have come in preemptively before their surgeries to get their body functioning better so they can tolerate the surgery better. And then they report back that after the surgery, their physical therapist is extremely impressed by how quickly they're able to progress because they're coming into the surgery in better physical condition, which means the surgery is less of a stress on their body, which means their recovery time after the surgery and their progression through physical therapy is markedly improved versus other people that go through the same or similar surgery and go through a similar rehabilitative process. Like, I mean, every single client that has come in for those reasons has reported that back as well. And I know that is not just at our office either, because I know that it happens at physical therapy offices where people go in, they'll do physical therapy prior to getting surgery done for that very same reason. So it's not just like you and me, Julie, that are sitting here saying this and noting this. This is something that is very well known, that if you get your body stronger, if you get your body functioning better, if you get your physical condition improved before going and having a surgical intervention, you're going to respond better. You're going to progress more quickly. You're going to heal faster. So that's a really, really, really big thing. You know, again, like our intent with this episode is not to say not to do some kind of surgical intervention, but to understand that there are other things to consider, one of which is the muscular system and how well your muscles are functioning. And by getting your muscles functioning better, even if you do end up having to have a surgery, you are more than likely going to come out of that surgery in a better place than you otherwise would have. And your recovery and your rehab will likely go more smoothly than it otherwise would have.
Great point, Charlie. And I'm just going to be super brief with this, but we've also seen this to be true when people are getting that new technology type injections with the platelet-rich plasma. So either way, improving joint structure or doing a medical intervention to change joint structure still requires the muscle system. And we today are trying to make also the argument that the just improving the muscle system can greatly improve the function of joints without even having to change the structure. So the first thing I want to talk about in terms of, okay, what are we going to do with these muscles? You're talking about these muscles things, you know, that they're going to be good for me. What the heck is that all about? First, I need to paint this picture because I don't think people think about muscles like this, and I do. So I need to give you a little bit of insight into my brain. Okay, so remember we talked about the person driving the car getting the outside of the car all beat up, and it's not really the outside getting beat up that's the issue. It's actually the user that is steering the car. Your muscles are the precise steerers of your joint. So that means when your joint moves, when your knee bends and when it straightens, when your elbow bends and when it straightens, when you raise your arm up to the ceiling, when you side bend, when you rotate your spine, all of those movements, every movement in your body, actually, any movement that you're going to do that you can think of, they are all precisely moved by your muscles. Okay? And so if this movement is causing issues in your joints, then people like Charlie and I, our colleagues, are thinking about stuff like, I wonder how we could teach those muscles how to be more precise, or maybe recruit in a little bit of a different manner. And as I mentioned before, the first way that we think about would be like teaching you how to move. Like, oh, okay, well, when you bend over, it seems to be really bothersome. Maybe there's some muscles there that are weak and deconditioned, meaning you just don't use them enough. You don't weight train regularly, which is part of a healthy lifestyle routine, is regularly weight training. I think a lot of people miss that. So I'll just say that one more time. If you want your muscles to be healthy, you need to be regularly weight training, regularly using them. Okay, so first of all, you might just need to get on a program where you're saying, hey, I have a wake-up call to my muscles, 3 times a week, reminding them that I need them to stay in top quality condition. And I'm actually going to go back and say maybe not top quality condition, but of a quality condition that I can live, again, live the life I want to live. Because if your muscles aren't in the condition to tolerate just the stuff you want to do throughout the day, you're not going to be very excited or happy or pleased with your, people will be like, oh, I'm just out of shape. You don't have to be a bodybuilder. I don't even need to see your muscles externally. Like I don't need to see any tone, what people call tone, or you don't even need to look fit for your muscles to be conditioned enough to tolerate the stuff that you want to do. So that's kind of the first thing is like, hey, are you even practicing strengthening the muscles? Because if you bend over and it bothers your back all the time, or you twist and it bothers your back all the time, or you do stairs and it bothers your knee all the time, very likely part of that, if not all of that, is just from deconditioning of muscles. The second thing that I want to talk about with us teaching you, or us teaching your brain how to better manage this, is to teach you a different form or a style of doing the same motion that you might have already been doing. I think one thing that's overlooked about trainers, well, I think a lot of things are overlooked about trainers, because I think we do normally fall in the category of some kind of glorified cheerleader. But a lot of us are actually trained in how the body moves and functions and how joints move and function. But we can teach you a different form or a different style of doing that same motion that might not add wear and tear to the joint. For example, let's say you're a driving teacher and you get this student in the car and you guys are driving, a Fiat. By the way, I love Fiats because they're tiny and so awesome. But if you've ever driven a Fiat, it's like an experience, right? It's like you got to figure out how to manage things, whatever. And then your next student is in a big tow truck. Okay, let's just say a tow truck. You're going to have to teach that student how to navigate turns, how to start and stop differently, because they're managing a different vehicle. Just like when people are managing different bodies, different joint degradations, everyone's got a different state. Us as trainers need to teach you how to change your form relative to what's going on. I can't teach you how to drive a Fiat when the only thing you know how to drive is a tow truck. And I can't teach someone how to drive a tow truck if all they've ever known how to drive is a Fiat and that's all they have access to, right? So it's always relative to what's available to that person, what's going on with their joints, what's their body shape and size and dimensions and proportions. All of that is something that a trainer should take in consideration when teaching someone appropriate form, because we've all been given different stuff in our bodies, and the better that we can learn how to move it, the better that our joints are going to tolerate that movement.
Yes, and that is such a huge point. Our bodies are built differently. Our bodies have different abilities. Our understanding of how to use our bodies, how to access certain muscles is different across the board. And so, as such, how we go about training our body and trying to strengthen our body needs to be different person by person as well. Now, one thing that we brought up a few different times so far this episode is the idea of muscle activation techniques. And so I want to touch on that briefly. And we've had a number of episodes where we've gone deeper into MAT. But what I want to highlight today is the ability of MAT to get all of your muscles working well. All of the little muscles, all of the big muscles, all the muscles that you think about, all the ones you've never heard of before, get all of them working well so your muscles can then support your joints better and support your joints more appropriately. So when you do go and exercise, your joints are able to move better, your joints are able to have stress better managed as you're going across them, and the workload of exercise gets to be more evenly dispersed, okay? So think of it this way. Why is it so important to have all of your muscles working as well as it could? Well, have you ever seen one of those giant symphony orchestras? Not the ones that have just a handful of people, but the ones that have a handful of trumpets and 17 clarinets and all these different instruments and multiple of them. You're thinking, okay, well, who in their right mind needs an orchestra that has 17 clarinets? Wouldn't 2 do? But there's a reason why the director of the orchestra wanted 17 clarinets, because for the pieces of music that they were going to be playing, 17 clarinets gave the right sound. Now, you might be sitting there as a casual listener and have no idea whether or not, not be able to tell a difference if there's, 17 clarinets or 16 clarinets, or 17 clarinets or 12 clarinets. But I bet if there was 17 clarinets versus like 2 or 3 clarinets, you'd be able to notice a difference. Okay. And all right, where am I going with this? Well, here's the thing. Our muscles are kind of the same way, where you look at the body and you might say, wow, there are so many muscles that can say lift your leg. There are so many muscles that can like turn your trunk. Why is it so important that all of them are there? Well, even though there's a lot of muscles that can perform the same outward motion, each one has a very specific responsibility as far as not only producing the motion, but also managing the forces that are going across the different joints and helping to precisely move and position the joints. And so anytime any one of those muscles go out, it changes the requirements of all the other muscles involved, and it changes the opportunity for those joints to move and for those joints to be positioned. All right. So you may not notice if one of your muscles goes offline and doesn't work as well. You may not notice if a third of your muscles go offline and not work as well. But just as you would notice if the orchestra went from 17 clarinets down to 1, you're likely going to notice if your muscles go from, 17 muscles trying to perform a motion down to 2 or 3, because those 2 or 3 are going to really not feel well. Okay. Well, just because that's when you start to notice the issue, or just because that's when the issue is big enough for you to actually take action on, doesn't mean that's actually when the issue starts, right? Because if you have 17 muscles trying to do something, the issue didn't start when you're just down to your last 2 or 3. The issue started when you're at any other number other than 17. And when you're at when your muscles were functioning any other way than 17 muscles working optimally. All right. So MAT, what it's going to do is it's going to get all of your muscles working well, get all of your muscles working optimally. So even though you may not notice when just a few muscles are offline, or even like half your muscles are offline, it's going to take care of those issues before they become symptomatic. It's going to take care of those issues before they become into bigger issues. And what this means for your joints is your joints get to be better supported, your joints get to move better, your joints get to be positioned more efficiently, which over time, over the long haul, if there is any kind of joint degradation going on, it will help to better manage that situation, because the muscles that are supposed to be helping to protect that joint are able to do their job.
Charlie, I'm just going to pat us on the back real quick, because we are just dropping amazing analogies during this podcast today. And I love the orchestra analogy you just gave. And I wanted to, one thing I've noticed through the years is, and Charlie, you can either relate or just not comment, but a lot of my own clients will ask me, Julie, do you get MAT? Like, you're in your 30s, why would you
You're
need
almost
MAT?
in your 30s.
I'm almost in my 30s. Come on, I got a couple months until I'm in my 30s. Anyways, you're young. Why would you need MAT? And I say, actually, I get worked on every week. And people are always blown away by that, because the sign that normally people label as progression with MAT is coming in less and less and less. But Charlie and I have been working on each other every single week for, I don't know, at least 6 years now. I would say maybe 7 years, but I think now in the last 5 years, it's been like definitely hardcore once a week. Anyways, moving on. And the reason why we do this is, number one, I think now that Charlie and I have had access to MAT for so long, we were like kind of wussies about, like, we know MAT will solve the thing we're feeling. So we're like, why not just get it addressed right now while it just feels quote unquote off, rather than painful or too uncomfortable. But anyways, the way that Charlie and I like to treat our bodies is like, hey, there are 17 clarinets that are helping me side bend my core to the side, and I don't know what's going on, but I'm not sure if all 17 are there. But we really don't like to wait until there's one. Because if you think about it, your body is constantly telling you when things are off. And a lot of us don't like to take action until we're like, it's not only off, but I can't even do the stuff I want to do. Like, I can't even get out of bed. That's how bad it is now. That means you're like down to one clarinet doing its thing. But if you can imagine, I don't know why I was singing this, but I was thinking about SpongeBob. And if you've ever watched SpongeBob, I have not watched SpongeBob for years, but I remember when I used to babysit in high school, we watched SpongeBob, and that octopus, he plays the clarinet. Squidward plays the clarinet. So
he's a squid.
Yeah, he's a squid. And so I was thinking, okay, so there's 17 clarinets and 2 clarinet players aren't feeling well. They're not coming to the performance. And so I see the rest of the 15 like kind of having to bulge their eyes a little because they're having to play a little louder, to make the same sound, but without those 2. And then eventually, if more and more players start not showing up, which very often happens in our body, meaning muscles start not working well, the ones that are left over, like the 5 clarinets that are trying to pull the weight of what was supposed to be 17, their eyes are bulging, their mouth is completely dry because they're having to play crazy amounts. They're probably not even able to do what fully you could do with 17, but they're trying. And those are usually the symptomatic ones, and those are usually the ones that are causing, some of the wear and tear on the joint because this is not being distributed evenly. But the more that we can get all those clarinet players back on board, the more lovely the sound, the more the sound is supposed to be the way it was supposed to be, even though those 5 were getting overworked for some time. Now, this relates to our bodies because a lot of us don't think of this. For example, we think of like hip extension as like, oh, it's our glutes, one muscle. Well, actually, when we work on hip extension in muscle activation techniques, it's a list of muscles. We do not just work on the one muscle that you've thought of when you do hip extension. It's not to your fault, but this is not what you study all the time. So every motion of your body, and remember, motion is muscles controlling joints, muscles precisely driving, hopefully, joints. And when the muscles are not working well, or half are not working well, or they're not as precise as they could be, or they're compensating for some other muscles, then the thing that gains the wear and tear is that structure that we call the joint. And so when we're having these joint issues, arthritis, bulging discs, something uncomfortable in our joint, again, we always think about, oh, it's a joint issue. We got joint degradation. Well, most of us don't think of the word degradation, but it's like, dang, my joint is zingy or it hurts or something's weird. But remember, the thing that is trying to precisely control that joint is the muscle system. What muscle activation techniques does that's different than something that you could do in physical therapy, or if you've ever heard of the name corrective exercise, or what I was kind of talking about in the beginning, like learning a new form. I don't have the form down correctly, or, I've learned how to use a Fiat, but I need to learn how to use the tow truck style, that whole thing. What muscle activation techniques does is it figures out how to make sure that all the muscles are available to work. It's almost like, hey guys, we need a team of people to be on call for when we need this. But if we only have one person on call, we might be kind of screwed if we need 5, right? So let's make sure we get all 5 or all 17 or however many we need. So what muscle activation techniques does is it allows your body to have the ability to access all your muscles. Whereas when you're exercising or doing things that we traditionally think about as exercise, or even corrective exercise or rehab exercise or whatever thing you want to label as exercise, that your body will very much struggle to access without the use or addition of MAT.
So is joint degradation just simply a symptom, or is it actually the root issue? And the answer is, well, we don't know, but I don't know that I've ever had a client come in with some kind of joint degradation issue that also hasn't had some kind of muscle system issue as well. And what we see time and again is when people's muscles get working better, there's a greater opportunity for the joints to move better. There's a greater opportunity for the joints to be better supported, which sometimes can change what's being experienced as a joint degradation symptom. And over time, may allow the joint degradation that's occurring to not occur as much, not occur as quickly, or even, best case scenario, maybe not even occur at all. But again, that's a very, very individual case-by-case scenario. At the end of the day, what we just want to offer you is another perspective to different joint degradation issues that you may be experiencing or that you may know of somebody experiencing, and say, hey, you know what? There's another piece to this puzzle here that doesn't often get discussed, and that is the role of the muscles and the role of the muscles to move joints, the role of the muscles to position joints, and the role of the muscles to support joints. So who do you know that needs to hear this episode? Who do you know that is either experiencing a joint degradation issue or has experienced a joint degradation issue and is interested in exploring what else might be contributing to these joint issues? Share this episode with them so they can learn more about the role that muscles may be able to play in helping support their joints and in helping make sure that the joint degradation issue does not get worse over time. And while you're online, head on over to iTunes and leave us a rating and review. It helps people find this podcast when they're looking for information on exercise and when they're looking for information on health. So if you found value in this conversation today, let us know by leaving us a 5-star rating and review. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week. We'll talk with you all next week. Hey there, it's Charlie again. One last thing. I want to let you in on a secret project that I've been working on for quite some time now. I am planning on releasing a book by the middle of summer 2021. But here's the thing, because I'm self-publishing this book, there's only going to be a limited number of copies available at any given time. So to learn more about this book and to be one of the first to find out when this book actually gets released, what I need you to do is go to exerciseforlifemethod.com. There you'll find out more information as well as some exclusive bonuses that I'm offering just for simply staying in the loop with what's going on with this book. So to learn more and claim your bonuses, go to exerciseforlifemethod.com, enter in your information, and you'll be automatically kept up to date. Learn all about the book and bonuses at exerciseforlifemethod.com.